And now it's Deborah Kobylt Live.
Hi, everybody. Thank you so much for joining us today on Deborah Kobylt Live. I'm your host, Deborah Zara Kobylt. And I've got a question for all of you. Do you have gut issues? Because we have a really important guest today who may be able to address that. Immunologist and allergist Dr. Dean Mitchell, who wrote this terrific book, Conquering Candida, the new 30-day protocol for restoring your microbiome and health. Thank you very much for joining us today, Doctor.
Thank you for having me, Deborah.
Here's the big question. We are all told microbiome, probiotics, these are all these like buzzwords, right? You got an issue with Candida. Are you taking antibiotics and not taking probiotics? I don't know. It's so confusing even for me, which is why I got to say this book is terrific because it breaks it down. It's simple to understand. And as I was reading it, I thought, oh, I identify myself here in this chapter. This is important. Why did you write it? Tell me what you're seeing in your practice.
That was a great lead-in because I've been practicing for over 30 years. My practice started very conventional as doing allergy and infectious disease. And over the course of years of practice with my wife, Dr. Ricky Mitchell, we got very involved and interested in holistic, or what's called now functional medicine. And I trained with some really top people. I did training out in California, once with Dean Ornish for a while and other places. But one of the things we started to see in our practice, and was one of the most frequent things that we saw, was something that I'm going to call Candida overgrowth. And these were patients that were presenting with a range of symptoms, from gut symptoms to skin conditions to severe chronic fatigue. And we were struggling to understand why these patients were getting it. What could we do to get them better? And one of our sources, and it's quite old, was a 50-year-old book by Dr. William Crook called The Yeast Connection. Now, Dr. Crook in the 60s, I believe, wrote the book because he was seeing in his practice, he was actually an allergist, and he was seeing these patients coming in with all of these strange conditions that other doctors, thought the patients were making it up, that they couldn't figure it out. And Dr. Crook got a tremendous following. I mean, his book, The Yeast Connection, has been republished multiple times because it's so popular. But he was criticized. He was crucified, because they said, you're making this diagnosis up. These people are all psychiatric. They don't really have these things. And what Dr. Crook, unfortunately, was working a little bit blindly. They didn't understand the microbiome as we understand today. And that's one of the main reasons I wrote the book, because I've been seeing these patients in my practice. And even when I talk to my conventional colleagues, they kind of look at me a little strange until I speak to them for a few minutes and say, look, that's why I talked to a friend of mine who's a dermatologist. This is why your patient with the rashes are not getting better. You're just using the creams. You didn't address that their gut microbiome was off. And the same thing with my friend of mine who's a rheumatologist. That's why your patient with the arthritis is not getting better. You're just doing the Band-Aid, giving the medication, not treating the underlying cause. So the book, to me, was important to bring the science, up to date in treating these patients.
Right. So, for example, these are common symptoms and it could be anything, right? I'll give
Right.
you myself as example. My gut, half the time, it depends upon what I'm eating, right? I'm bloated out to here. So I've tried everything, right? I'm like, all right, no bread, no pasta, maybe, gluten-free stuff. And then I go get tested and I don't have any issues whatsoever. And I'm like, okay, what's the problem? I'll go on a liquid diet. And then for whatever reason, I still have a bloated stomach. I don't know. Maybe it's my age. I don't get it. But I've
Yeah.
had every possible test known to humankind and nobody can find anything. What could it be? I mean, I'm asking you to sort of answer something in the dark here. And I know that I'm not alone, right? With
No,
symptoms like,
you're not. You're actually what you're saying is so common, and
yeah,
that's what's frustrating to patients. It's frustrating to doctors too. And that, again, that's another reason I wrote the book. And in, I think, chapter 2, what I do, and I explain this, hopefully clearly, that I have a special 15 directed questions. And
Yeah.
honestly, if somebody answers yes to just a few of them, there's a good possibility that they have Candida overgrowth. And again, that is why it's important to see a medical doctor about this, because you do want to rule out other conditions. You want to make sure somebody doesn't really have celiac disease. There's ways in the blood to test for that. You want to make sure that they don't have anemia. There's ways of testing for that. But when a lot of these other things are negative, or then you have to really consider what hasn't been considered. And again, an imbalanced microbiome, which is a result, which results in Candida, can explain a lot of these symptoms. And the beautiful thing is that it's very treatable, because even within a few weeks, when I can put a patient on a specific diet, which is not forever, but just in the beginning, to not let the Candida overgrow, use some safe medications to reduce the amount of yeast overgrowth, these patients within weeks start to feel better that they've been suffering with for sometimes decades.
Yeah. So then tell me, what do we test for? What are the questions that you ask people? Again, I know it's in the book,
Yeah,
but I want you to talk
yeah.
about it so then people will run out and buy this book. It's important.
Yeah,
It's
well, the thing
Go ahead.
is, yes, the thing is this, and again, a patient, maybe even like yourself, experiences bloating. I have a lot of young women, they'll show me pictures on their phone. They'll say, Dr. Mitchell, this looks like I'm 4 months pregnant after I just had a sandwich, and it's very uncomfortable, and et cetera. So, you know, one of the main things that I get, and I was talking about this in another interview that I gave recently, that one of the things that's becoming a lost art in medicine is a doctor taking a really good thorough medical history and spending the time with the patient, because that's what you need. That's what we were trained to do. Yes, it's great when we can order a test and order a scan, but a really good clinician should be able to elicit the history from carefully listening to the patient. And the things that I usually always check for: does somebody have a history of extensive antibiotic usage? Now,
Mm.
for many years, until I would say even recently, people always thought antibiotics are super safe. You could take them for as long as you need to. It's antibiotics. But people who've been on it, typically I see, people even later on in their life, in their 30s or 40s, they'll tell me, oh, I was on antibiotics for a year as a teenager for acne. I was on antibiotics for 8 months because I had Lyme disease. I had a lot of women will say, I had a lot of urinary infections in college. I was on it every other month. These are warning signs to me that the microbiome has been disrupted.
All right. So if that's the case, what do you do to get that microbiome sort of back in balance? I mean,
Yes.
what's sort of the ABC of what you would do, other than
Right.
obviously
Well, right. And
taking
that
medical?
also I do. I mentioned in the book because, again, doing this for quite a while, and I think I've actually advanced what Dr. Crook was proposing, because it was very restricted back then. It's almost like diabetics. Back in the day, really going way back before they had insulin, diabetics had to starve themselves. That was the only way to prolong their lives, which, was really very draconian. The same thing with Candida. Dr. Crook proposed in his day, because they didn't have the tools that we have today, he proposed a very strict diet of no sugar, no dairy, no wheat, no alcohol, et cetera, et cetera. I mean, it was the diet that, for people to die from hell. But it was getting these people better. He also had a medication called nystatin, which is a very mild antifungal. We have much better ones today. So what I do in my practice, it's basically what I call the 4 pillars of treating these patients. Is, yes, for a while we put them on a restrictive diet, but we give them a lot of options. That's one of the things that I worked with my daughter-in-law nutritionist Joelle Mitchell on, giving people a lot of options so they don't feel like they're being punished. And I don't want them to be antisocial, so they can't go out to restaurants or parties with their friends. You'll have choices. But then also, which is super important, I am able to write a prescription for certain antifungal medications, which immediately start to lower the Candida load in the body. Third, I have like a whole vitamin regimen that I do with patients, because we've got to keep their immune system strong. So many of these patients, if you ask me, one thing that I do find on blood testing is that they tend to have low mineral and vitamin levels. So it's sort of an indirect way telling me their gut is not really absorbing the vitamins even from their own food. And the fourth thing that I like to use, because I have a lot of experience with it, is what's called sublingual immunotherapy. Special drops you put under the tongue that build up your tolerance so your body handles the Candida better. and then you're able to expand your diet, and you eventually can also go off antifungal medication.
I'm going to break that down. What are some of the special diets that have been working? If you can just briefly tell us, like, would you say,
Yeah.
don't ever eat spinach, don't do this? Like, what tends to be in the broad category of
Yeah,
try
well,
this?
first of all, I sometimes like to use this term. It's a little bit what I would call, I don't know if anybody's ever labeled it, but like almost like the biblical diet. If it was around in the time of the Bible, you could have it. They didn't have all these packaged foods back then. But basically, it is sort of a combination of paleo, Mediterranean diet. We want to feed the microbiome the good stuff. So we all know, I mean, it's pretty common knowledge now, like processed sugar, really bad. Well, even worse for yeast. If you put yeast in a dish and you give it sugar, it just starts to overgrow. Okay, so that's number one. Two, we feel dairy is probably not great, especially milk, because milk is essentially a sugar, and dairy probably not as good too. A lot of patients don't tolerate it well. So they start to get that out of their diet. All of a sudden, their bloating starts to really go down, and a lot of their symptoms, even like joint issues, start to get better. The third thing, this is an important one, because oh my gosh, I get this mistaken all the time. Fermented foods are bad for Candida patients. Now, you'll hear in the public a lot in the press, oh, fermented foods are great for your gut. Yeah, if you're a Chinese farmer and you've never had antibiotics, probably eating kimchi and all that stuff too is probably good. But people in our society that have had Candida overgrowth, fermented foods will set off and cause the fermentation even worse.
What's a fermented food?
Okay, so like kimchi, those sauerkraut, foods that they let the yeast overgrow in the food to they do it in certain cultures to bring out the flavor. I guess I have to mention this because there's a little story I put in the book, which I think is so emblematic of this, like the most extreme type of condition. And it's actually called auto-brewery syndrome. And these are cases that have been well documented in the literature. I've seen a couple in my own practice. So what kind of patient is an auto-brewery patient? This is a patient, again, that's probably been on antibiotics, maybe even what we call acid blockers, the strong ones like the proton pump inhibitors. And what it's doing is it's changing the microbiome. It's letting the Candida overgrow. And now it's becoming literally a brewery. So what happens, again, the case that I mentioned in the book is that there was this woman who used to drink alcohol occasionally, and she had been on antibiotics a lot for infections and was on acid blockers for stomach upset. And she started to notice when she drank alcohol, she got drunk immediately. So she had to stop drinking. Okay, fine. She goes one day to an office party. It was around probably Christmas time. And there's a lot of cake and breads and everything, and she's enjoying herself. She's leaving the party. She feels a little woozy, didn't have a drop of alcohol. Driving in her car, went past the stop sign. Police car happens to be in the neighborhood, pulls her over, says, ma'am, take out your license plate, etc. She does everything like, whoops, okay, sorry, I went through the sign, whatever. And he smells like alcohol in her breath. And he said, ma'am, can you step out of the car? I want to do a breathalyzer on you. And he does it, and she fails terribly. Now she's got a DWI. And this happened a couple of times to this person. And she swore that she didn't drink any alcohol. And she went to several doctors at first who didn't believe it. They were ready to put her in one of those addiction programs. And it turned out she was fortunately eventually referred to a gastroenterologist who recognized this auto-brewery syndrome. Literally, her microbiome intestine, which was filled with Candida, was taking the carbohydrates and turning it into alcohol. And
wow, that is one of the most extreme cases.
That is an extreme
case.
Crazy. Right. That's an extreme case. The reason I bring that out, though, is because it's on the spectrum of the patients that I'm seeing. I mean, again, I don't see patients that get that bad. Not every week. I've seen a few, but I have all these other people in between. So again, when you were asking me, like, why, again, in the beginning, I have to have patients avoid the sugar, the dairy. I also ask them to try to really cut down on the wheat, because all of those things spike your blood sugar, which feed the Candida.
Wow. All right. So you mentioned a few foods that on a broad level that would be best to avoid. I don't disagree with any of that. And I try to stay away from that, although I don't know,
Smart.
sometimes I drink it. And, I mean, sometimes I eat these things and it or don't eat them and I still have an issue, in which case I think for somebody like me, I need further testing, right?
Right.
So what are some of the antifungals that you put people on? And also, what are some of the vitamins and minerals on a broad base that you would
Yeah.
recommend that people take?
Yeah. So the antifungals that we use, ones that are very effective, for example, something called diflucan or fluconazole. Women may be familiar with it. A lot of times, if they get a vaginal yeast infection, they'll go to the gynecologist and get a few pills. But this is the problem. 2 or 3 pills to treat Candida is not going to do it. You need a couple of weeks. And a lot of the doctors have this misunderstanding, and they've kind of floated this perception that antifungals are dangerous. I'm more afraid of chronic antibiotics than I am of antifungals.
Yeah.
And so I think that's one very important thing because you can't cure Candida with diet alone. I've seen too many patients that have come to me from around the country. They fly in and they'll say, I've been on the Candida diet for 2 years and taking all these herbs, and I'm like 10% better. And then I treat them within 3 weeks. They're like, I'm like 90% better. So you really need that doctor able to write a prescription. You need someone to guide you with the diet. And I've also found in my own practice, vitamin therapy, getting high dose vitamin C, B vitamins, all help strengthen the immune system. So your immune system is stronger and can handle this whole rebalancing process.
Right, right. But a lot of times, let's say I am on an antibiotic. Usually, by the way, it's only like 5 days. I'll get like a Z pack or something. Is
Mm.
that not good for my microbiome?
It
Because I
isn't because no, and the reason it's kind of deceiving. The Z-Pak, because it's 5 days, it's actually a very long-acting antibiotic. So it's doing the same thing as if you took it for 14 to 21 days.
Yeah, but what should I take? Like, I'll have friends who will say, "Go immediately and get a probiotic." I'm like, "Well,
Okay,
which
no, that's
why?"
a no. I'm glad you're asking such great questions because again, I address so many of these things in the book because there's a lot of misconceptions. So if I have a patient that calls me that's in my practice, I've been treating, has gotten better, and I tell them, I said, for some reason, if you need to go on antibiotic, just check in with me. I want to tell you what to do. Because let's say they go to their dentist. So the dentist says, oh, you had a root canal. You need a week of antibiotics. And there's no way around it. I tell them, go on a very gentle antifungal like nystatin. That's what they used to do years ago. And it kind of fell by
Right.
the wayside. So while you're on that, the probiotic is probably not going to help. I've been fortunate. I have a podcast, The Smartest Doctor in the Room, which I've been doing for 5 years. And I get to interview the top doctors in the country. So I have a
Right.
really good Rolodex of people I can always check in with. And one of the people that I've interviewed twice, who's fantastic out at UCLA, Dr. Mark Pimentel. He's head of, like the IBS center there. And he's specifically has shown in his research, we discussed on the podcast, that most probiotics are not really good for people, especially with bowel issues. It
Oh.
actually makes it worse. And the reason
Oh
that
no.
is because what he explains, and he's just a terrific doctor and researcher. He's one of the leading experts in the microbiome in the country. He explains, he goes, most probiotics have lactobacillus. And he said lactobacillus, he calls it the bully. It crowds out all the other um, good bacteria. So even though it's dominating, it's making your microbiome more homogeneous and less diverse. And one of the pictures I have in the book, because I had to borrow this from Mark, was that he made the analogy in one of his books, The Microbiome Connection, that the microbiome in your intestines should be like a city where you have a whole bunch of different people working, doctors, lawyers, plumbers. He goes, when it becomes more homogeneous, if you have a whole bunch of just lawyers, who's going to fix your toilet? So you want a really diverse microbiome. And lactobacillus, certain probiotics really don't do that. And again, actually are detrimental.
Right. Um, can you just, in very basic terms, explain what is microbiome? What is it?
Yes. Okay. So the microbiome, again, thinking a little bit like a city, we all are full of bacteria. We're full of viruses. We're full of, you believe not even some parasites. It's okay. They're all part of our system.
Right.
There's only two things that really, and again, this is my infectious disease training, which took many years to really understand. There's really two things when this situation goes bad. Is that
Okay.
when one, whether it's a virus or bacteria, or Candida starts to really overgrow and dominate, that's one thing. So, again, somebody gets sick. That's why we see with Epstein-Barr even. Sometimes when people have had relapses with that, it's because they're like with COVID, their whole immune system got depressed. So these viruses can now resurface. Same thing like herpes with shingles. But the other thing is that oh, what did I want to say? It was really important. I forgot. I'm sorry. But it was
That's
with
okay.
was it with long COVID? No, we were saying about
Well, we were talking about what is microbiome. If we could just break it down, these are
yeah,
all these
right,
bud. Go ahead.
right,
These are all.
right.
Go ahead.
No, no, you're right. Thanks for right. So what happens is right. So when the immune system gets like suppressed, oh, I know what I want to say. So important. Thank you for my came back. Is that when one of the, when your immune system gets suppressed for various reasons, then there'll be one organism that's probably resistant that starts to dominate and overgrow. And the other thing too, which is really fascinating, is that infections really take hold or place, because again, remember we have all these bacteria, is when something ends up in the wrong place. And I'll tell you what I mean by that. Like when you have E. coli in your intestine, that's fine. That's where it's supposed to be. But when you have gut issues or constipation and E. coli ends up in your urine and too much of it,
Oh.
that's when it's an infection. You understand?
Oh.
Another example of that too is Klebsiella, another bacteria that's part of our gut microbiome. It's supposed to be there. Someone gets sick and what they call aspirates, and that Klebsiella ends up in your lungs, now you got a dangerous pneumonia.
Right. Right. But I mean the microbiome in the gut. Like
Well, I'm
I don't
sorry,
know.
it's not just the gut. You have a
Okay.
microbiome on your skin, you have a microbiome in your sinuses, and each area of your body something may predominate, because possibly it's beneficial that it's there.
Right. Of course.
Because again, really a big interesting contrast, and I like to point this out to the patients, is that the microbiome on your skin is very different than your gut, but your skin is very different than your gut. Your gut, although it's only one cell thick, it's really incredible. It's so thin, the intestinal microbiome, the intestinal tissue. It can do that because our body produces mucus and everything that protects the lining, but our skin doesn't have that, and that's why, fortunately, our skin is 7 layers thick. If you look through a microscope, because if you get an infection through your skin, it's deadly because you have no other
Exactly.
defense. It gets right into your bloodstream.
Right. Let me ask you, on a basic level, you know how you always hear, eat some Greek yogurt. That's really good. What again? Because the only is there something also topically you can put on your skin? Because you're right, we're talking about various parts in the body where we can have an overgrowth of something that can develop, right? And then we have issues here. Is there something to put on your skin? Or is there something that is a must do every day in terms of consuming and eating? That people can really focus on and
Yeah.
do for themselves.
Okay. So just to go back a little bit into the diet, yogurt, believe it or not, is not really one of the best things either. It's a little bit overplayed again to the public
Oh
because again,
yeah.
they're milk based, and again, it's not great for people. So I usually recommend to people that like yogurt to get the almond or coconut variations. Um, the most important thing also I always tell people I think is to feed your microbiome the good stuff. When I say the good stuff, I mean like prebiotic food. So that's why vegetables and salads, all of those things. I like ground flaxseed. I call it good carpeting for the gut. Your
Mm,
good bacteria that are supposed to be there will will benefit from that. And that's what makes a happy gut, if you want to call it that.
yeah. How about topically on your skin? Is there something
That's a
that you
more
think?
interesting question. I think they're really looking into that. Um, I don't think they've really come up with yet anything that makes the skin stronger that I'm aware of.
Hmm. I put something strange on my skin. I haven't the faintest idea if it's good for anybody. I don't endorse it. I put extra virgin olive oil all over, and it seems to, keep my skin
Well,
smooth.
that's interesting. Yeah, putting good oils or like coconut oil because you're hydrating the skin. I mean, look, olive oil, again, remember I told you about the biblical diet? They used olive oil back in all those kind of, religious ceremonies. There's something
Everything.
super beneficial about it. I'm definitely a big fan of extra virgin olive oil.
No, and I've actually I put it on my hair. I put it everywhere. So I actually believe that's got medicinal purposes,
No, it
whether it
does.
has
Oh, it does.
anything, yeah, whether it has anything to do with what you're talking about, I have no idea
No,
because
no,
believe
it does. It does. I mean, that's one of the very important facts that I want in people's diet. I mean, because your body needs that, you know, that variation of good fats, good protein, and some good carbohydrates too. I'm not a carbohydrate police officer. Like I come to your house and arrest you if you're eating, carbs.
yeah, I mean it's hard to do that. I personally find it really difficult
Very hard. I
to
myself too.
stay.
I'm a
Yeah,
card carrying member of this thing too. I have to find that balance in my diet that I feel good and I feel healthy.
what's the questionnaire that you don't have to go through the whole list of
Yeah.
15, but what's the questionnaire that you give to people when they first show up at your office or you do
Yeah.
telehealth with someone? What do you ask them? What are some of the basic questions to get
Yeah.
a
Well, like I mentioned, the really important ones, because Dr. Crook had a questionnaire which was very interesting. I mean, because he gave points to everything. I don't really do that. I just want to really know. I want to get that history from you. But if you've had a history of antibiotic usage, it's important. If you've had a bad stomach and you've been on those strong proton pump inhibitors, that's important. If a woman's been on the birth control pill, unfortunately, because it elevates the estrogen, that's important. Um, those are some of the main things. And, then I want to know also your other medical issues. And, if you've had surgeries, because then I know usually antibiotics have been involved. Obviously stress is important too. I tell my patients having severe stress is like eating 10 cookies every day. And we all know 10 cookies is not so great for you. It really shoots up your sugar. But, when you're under chronic stress, from whether it's, marital issues or your job or whatever it is, it raises your cortisol, which in turn raises your blood sugar, which in turn feeds Candida and affects the microbiome. Now, we can't avoid stress. We all have it. But anyone that can figure out ways of dealing or alleviating it's helpful.
yeah. And then God forbid if you're the kind of person who just had 10 cookies and you're stressed out. It's like that's a bad day.
Well, that's it,
So
right? Because what do you do to relieve stress? You get those foods out that are the comfort foods.
as you're talking to me and we're talking about antibiotics and this and that, I'm thinking, did people have these issues if we're going back over 100 years before all of these modern medicines? Now we need these modern medicines. They keep us alive. Let me be very clear.
Right. Oh, yeah. There's appropriate uses for it, no question about it. But yet, to
Right.
answer what you're asking me, which is really interesting, is that no, they did not. And we know that there was actually a writer I had on my show, The Smartest Doctor in the Room. And normally I have doctors, but Dr. No, Moises Velasquez, very interesting writer. He's published in the New York Times. He wrote a really interesting book called An Absence of an Epidemic. Very interesting title, because what he did was he researched in the literature and he found in third world countries and sometimes other societies where these medical, autoimmune conditions especially were much less common than in our, quote, modernized Western societies. And the reason was they had a more diverse microbiome and they weren't exposed to the medications that we got. And one of the really most interesting studies was when there was a study done in Germany where, comparing East Germany to West Germany. And we all know like West Germany is more affluent and kind of closer to our society. But it was interesting, the people in East Germany had healthier microbiomes and less of these autoimmune conditions than they did in West Germany.
That's
Because
interesting.
it was a poor society. A lot of these people were workers on farms, and they didn't have access to medications. Now, I'm not saying, again, like I don't want to lead people astray. Like if you have a bad infection, yes, you should be treated with an antibiotic, but get treated appropriately, get finished with it. The other thing I always stress to my patients, I mean, it's one of the most important things I do. I say to them, please, if you have a respiratory infection, make sure your doctor gets a sputum. Let's see what it is. If you're having urinary symptoms, get that urine culture before you get treated. And I'll give you one of the quick examples that happened to me. I try to live by what I say. A few months ago, I had an infection, a respiratory infection. It was very annoying. I was feeling sick. And trust me, that temptation to want antibiotics was there. I was like, no, I can't do it. And then they have now these swabs. I did a viral swab on myself that tests for 20 different viruses. And, of course, I checked myself for COVID and flu, and I was negative. But lo and behold, a few days later, it came back para-influenza. So it made me feel sick, but I knew what it was, and I knew antibiotics weren't going to help. So again, I
Yeah.
didn't do myself the disservice of taking antibiotics.
Yeah. When a doctor prescribes an antibiotic, should he or she not then prescribe a protocol that, just to make sure that something doesn't now happen after that, to, be a little proactive about what
Yeah,
might happen because they never do that. And then I'm
yeah.
always getting concerned about the after effects, but then I don't know what to do. I mean, it just feels like they treat
No,
you
it's a
poorly,
really important question. So
right?
what I
So,
advise my patients is this, because especially obviously I'm dealing with Candida patients, but it really makes sense for a lot of people. So for my Candida patients, for sure, I tell them you should be on a very gentle antifungal like nystatin while you're on the antibiotics, because at least you're getting that counterbalance effect. They used to do that decades ago. It just got
right.
thrown by the wayside. The second thing, which makes sense, is be very careful. When you're on antibiotics, seriously, watch your carb intake, that sugar. Be very careful because, again, people don't feel well. You just feel like eating what you want to eat. But eating pizzas and pastas and cookies and all that while you're on antibiotics, you're really making your microbiome unhappy. And that's where, it's so not uncommon that I hear a story like of a woman, I had a urinary infection or I had a respiratory infection. They put me on antibiotics and, I wasn't eating well. I didn't feel good. And then 2 weeks later, after the antibiotics, they have a vaginal yeast infection and they're really uncomfortable.
Oh my gosh, all of this is just almost terrifying to talk about, right? But we have to pay
Well,
attention. No, but it's true. We have to pay attention because
well, you
everything that
do.
we're,
Look, you're right. That's why you need the guidance. I mean,
yeah,
and that's why working with somebody, because honestly, you can avoid a lot of these pitfalls. But it's like if you put the blinders on, more bad things can happen.
let me just say, doctor, but you're making a great point, is what I mean, because everything you're saying, I've had it, right?
Mm,
It's happened to me. And then
yeah.
often I don't know where to go, which is why I think this is a great book. Easy to digest, if I may use that word,
Thank
because
you.
it's very simple. It's a simple read. And I know you also do telehealth, right?
Yes.
Okay, so like this is a no-brainer for people that think they might have some symptoms, think they might have an overgrowth of Candida. Just pick this up or get in touch with you. Can you give us just a very brief ABC version before I let you go of the 30-day protocol? Again, I'm not trying to break it down so people do it on their own and do it wrong, but just some elements that are a constant throughout that 30 days.
Yeah. So the diet obviously is front and center, but
Yeah,
again, and we do ask you to do some of the restrictions or at least cut back on things. But we in the that section again with Joelle, we give you a lot of options. I don't want anybody
yeah,
feeling deprived. I'm not saying it's
right.
easy, but when you have a lot of choices, I'll give you a quick example. Like I like pasta, like who doesn't like pasta? But I used to feel really sick when I would go to a restaurant and they put all this heavy sauce on and whatever oils they use. So when I'm at home, first of all, I use the chickpea pasta or lentil pasta. I boil it up. I steam my vegetables. I toss on. I actually like to use a little bit of lentil soup. I can't tolerate tomato sauces; they're too acidic, and they put a lot of
Right.
junk in them. And I enjoy my pasta. Or if I
Yeah.
go to a restaurant, a lot of times now too, I thank God for all the gluten sensitive patients because they usually have zucchini pasta. You have choices. So for a while sometimes my friends when we go out for dinner would say, "Oh, what's Dean gonna order?" Well, he'll hear his whole healthy thing. They make a little fun of you. But I'm like, at the end of the dinner, I feel good, and I feel good the
Yeah.
next day. It's worth it. I don't want to feel lousy.
Yeah. So, any parting words before we let you go? I mean, you're sort of this great wealth of knowledge, and I could
Yeah,
see
but
as you're talking, you've got so much information in your head to
yeah,
share with us. And I think that's really valuable. I think even just making an appointment with you telehealth, I'm not telling people to do that. That's not what I do in my podcast. But I guess it's of interest to me. I'm going to make one
Yeah,
because
no,
I need to figure this out. Go
well,
ahead.
I'll tell you one last thing too, which is really an amazing equalizer now. I mean, medicine is in a way in a golden age. Telehealth, you can have like an informational consultation, which I do with patients around the country, almost like we're doing on this,
Yeah.
interview, and get a lot of information because that's what people want, and then work with your local doctor. Um, but the other amazing equalizer really is the AI now, like ChatGPT. I have so many patients coming to me who found me, I come up high ranked on ChatGPT for Candida or some of the other things I specialize in. And I actually like it because they're very educated and informed. And the only thing I say to them, which I truly believe, is that I'm glad you got this information, but now let me guide you because otherwise you can go down all these other rabbit holes that can lead
Right.
to dead ends. If I've treated 1,000 patients with what you have, I think I could get you there faster,
Mhm.
without any of the mishaps.
So how do people get in touch with you? Are you big on social media? How can they do that?
Yeah, well, we're listed. We have a website, Mitchell Medical Group. There's a lot of information on the website. So, and my staff is amazing. Maria, Patty, Ruth, they're just wonderful. They're my extension of my practice. I mean, that's one last thing too. I was telling somebody else in an interview. I said because they say, "Oh, it must be so hard. Why can't we find people that are doing the kind of work that you're doing?" And I said, "It's been hard. I mean, for 30 years, I've been in my own independent practice. So many doctors now are working for hospitals, and the hospital regulates how much time they can spend with a patient, or they're not allowed to do certain therapies because it's not in their guidelines. I've been fortunate. I don't have to give a damn about any of that. I want to treat patients the way I want to be treated, and that's still the reason I like to fight the good fight."
Yeah, no, it's very important. We have to advocate for ourselves because I am one of those people who's gone into the doctor. I have a terrific doctor, but she can never find anything. So perhaps it's even in the blood work. They're not ordering the correct blood test or the blood work, right? That's a big one too. And I'm sure if I were to meet with you, you'd say, we got to get you tested for this and that because you do need to do the deep dive, right?
Well, that's another really great last point. This is where patients get frustrated. I mean, I'm not blaming doctors, but again, they've been
No.
trained. They do your general CBC, general chemistry is great. 98% of the people that I see, because I know I do that test anyway, or I have them send me that if they've had it done before, is normal. But I'm
Yeah.
looking even deeper, and I'm looking at your vitamin and mineral levels because they are important, and they just, are not always like considered essential or routine. But I think in today's world, they are.
Well, let me ask you this, if we have to get personal here. I just recently got some blood work done, and I'm in the sun every day. I take my different supplements, and my vitamin D is down to practically nothing. What can that mean? Like, and then what
Okay.
happens very often is I don't get an answer. It just sort of dies there. So I'm like, well,
Okay.
now what do I do? What?
Okay. So no disclaimers here. I'm not into that. But
That's okay.
vitamin D is you can't get it from the sun enough. It's just that, and a lot of times even our body and our skin doesn't convert it as we get older. So I put patients on vitamin D3 K2 liquid drops. And I'll tell you why. There's a really good brand called LiveWise. Again, check with your doctor, whatever your levels. But if you have a low level, and most people are not even if you're in the normal range, like 30, which they consider the bottom, it's a little bit too low still. Ideally, you should be in the 50 or 60 range. And the way to do that is with these liquid drops. And typically, a patient would need like 2 or 3 drops, which is about 3,000 units. I like also, this is probably one of the last important things I can mention, again, so many of us, our gut doesn't absorb the vitamins well. I think you get about 1%. That's why I
Right.
do a lot of injectables, but not for vitamin D. But what I do like is when you use things on your tongue or sublingually, you get much higher levels because
Okay.
in medicine, one of the things we learn our first year of medical school is called the first pass effect. When you swallow anything, whether it's food or it's a pill like a medicine or a supplement, the stomach breaks it down, but then it goes to the liver. The liver is your detox organ. So let's say that you swallow that vitamin D3, it goes into your stomach, it breaks it down, it goes to your liver. Now the liver say, hey, is this safe to send to the rest of your body? By the time it's detoxing it, it gets less of it into your bloodstream. When you take something safe under your tongue, sublingually or on your tongue, it goes right in. It misses that bite, that pass through. So, and of course, injections, we bypass that as well. And, you know, some of my patients that are sick, they need those higher levels. See, that's another sort of misconception too. Like just because, oh, your level's not abnormal. Well, if you're on the lower end of normal or you're sick, you tend to need more vitamin, you know, to help your body detox.
Well, you're terrific. I could go on for 2 more hours with you. I really could. But people, if you want more information, look up his website, Dr. Dean Mitchell, and absolutely pick up the book, Conquering Candida. I think I called it Candida before.
It's
Conquering
okay.
Candida.
I don't get offended. Some people do, but I don't.
No, I know. The new 30-day protocol for restoring your microbiome and health. Terrific book, easy to read. For me, that's important, right? I was thumbing through it initially and I thought, oh, there's a chapter I have to get to. So this is an easy one to read. It's informative. They can reach out to you and make an appointment. I think it really is important for all of us who believe that we may have issues. I'm one of them. And investigate, you know, see what might be going on so that, you know, we can live a sort of a healthier life, less bloat. That's a big one for me. And, you know, get yourself in balance. We all need to get in balance. So, Doctor, I appreciate you joining us today. Thank you very much.
Thank you for having me, Deborah. Appreciate it.
Yeah, and please, you'll find our interview with Dr. Dean Mitchell on YouTube. Then we'll post it after on Facebook, and then as an audio podcast. Right, we're on the iHeartRadio app, we're on Spotify, just about anywhere that you want any information about this show and Dr. Dean Mitchell and his book Conquering Candida. You'll find it on our program. Then after on his website as well. So I really appreciate you joining us, Doctor. Great information. You're very enthusiastic about this. And I appreciate that because we need doctors who are excited. They want to say, I'm going to get you better. I'm going to figure this out. We're going to figure this out together. So thank you so much. Everybody, my show, Deborah Kobylt Live, you can find it on all video and audio podcast platforms. I'm your host, Deborah Zara Kobylt, and thank you so much for joining us. Bye-bye.